Okay, so we was on the question number 25, I think, right? So 25 question was theirs, and बाकी कल का सबको समझ आया? Like everyone understand what we studied yesterday? Any problem? I hope no. Okay, okay. Let's see. For a week, a 42-year-old patient has been suffering from the fever attack followed by the high temperature. Our screen is not here. So we have seen the followed by the high temperatures which occur every 42 hours. I hope every one of you know already, or every one of you maybe have suspected the malaria in your lifetimes till now. So what you will get in the malaria, that every 48 hours you will get the increase in the high temperatures, and then there is a decrease in the temperatures to the normal. So there will be the increase in the temperatures, and it occurs like after every 48 hours. Sometimes what happen, the patient will be feeling so much shivering or so much cold at this temperature. Body temperature rise up to 40 degrees Celsius and decrease in 3 to 4 hours with the excessive sweating would be there. This is the cold sweating. The patient present with the loss of appetite and general fatigue. The skin is pale and yellow. The liver and spleen are enlarged and dense or palpation. So what method of the diagnosis verification would be most efficient? So always remember, when we do the like when is the case of the malaria, so in case of the malaria we will be having that for the diagnosis what we will do, we will take a stain and we call it the Jaswant Bhattacharya stain. We call this as the Jaswant Bhattacharya stain, and in that stain we will take a smear. So in one side we will take a thin smear and another side we will take a thick smear, and the thick smear we will differentiate between the Plasmodium vivax or the Plasmodiums falciparums, and on thin smear we will check about the what is the quality or what is the quantity of the Plasmodiums. Okay, so remember that malaria. So malaria, first of all you should know what it is caused by. So it is caused by Plasmodium. It is caused by the Plasmodium, and we will be having in the Plasmodium there is a 4 species would be there. The 4 species we have the Plasmodium, and out of that 4 species, remember the Plasmodium falciparum is a very dangerous one. Plasmodium falciparum. There is also Plasmodium malariae, Plasmodium vivax are also, but falciparum is what, that is the very dangerous things, and what it will cause, it will affect the brain. It will affect the brain. So in the brain we call this is the cerebral malaria. What we call this condition? We call this condition as the cerebral malaria. We call this condition as the cerebral malaria. In cerebral malaria, remember, when you will see about the microscopically, you will see the smoky gray brain. What you will see? The smoky gray brain. You will see the smoky gray brain. In malaria, what we have seen, that there is a increase in the temperatures, and then after the few hours there will be the decrease in the temperatures. So always remember, when we talk about the malaria, in malaria there would be the relapsing fever would be there. Which fever? There would be the relapsing fever. There would be the relapsing fever. Along with the relapsing fever, what you will see, the headache will be there, and the patient would be having the chills and sweating. That will be the cold sweating. The patient would be having the chills and the relapsing fever will be there, that you have to remember. And what are the diagnostic criteria for the diagnosis for the malaria? So remember what we will do, we will do the blood smear. We will take the blood smear, and other than that they can ask you the profile axis also. So remember what is the profile axis of the malaria. So the profile axis of the malaria is the chingamine. The profile axis of the malaria is the chingamine, or we can give the chloroquine. CHLOROQUINE, chloroquine. We can also give the chloroquines. Okay, what is the treatment we will give? The treatment we can give, that is the primaquine, then mefloquines. All these can be, all the queen can be given. So remember the chingamine or the chloroquine, these are the profile axis, and for the treatment purpose, remember this is the sign of the treatment. If in the treatment, what will give the primaquines or the mefloquines or the atomoquines, And remember that these are some clinical features, like the patient would be have the relapsing fever, the patient would be having the headache, the chills and the sweating. And for the diagnosis, remember what we will take, we will take the blood smear. For the diagnosis, what we will do, we will do the blood smear testings. Okay. And remember, in the malaria we will be having the plasmodium falciparum that will affect the brains and that will cause the cerebral malaria. After that, question number 26. The 26, remember, a 16-year-old adolescent living in a rural area has been bitten in the shin. What is the shin? The tibia part, okay, the calf muscles part, by a stray dog. The wound is superficial. Regular vaccination against tetanus was received 3 months ago. देखो, usually what when the patient will come with the come with the biting of the stray dogs, when the patient will coming with the biting of stray dog. So if the biting of the stray dog are there, what the patient should have to do with the biting of the stray dog? The first things you have to do, that you have to give the injection of the TT, that is the 0.1 ml 0.1 ml TT injections, yani ki that is the toxoid tetanus, or sometimes now it's currently coming at the TD, the diphtheritic also. After that, we have to give the rabies course. We call the anti-rabies vaccination. The rabies course, that is the anti-rabies vaccination. But if the patient has already taken the injection of the TT 3 months ago, usually what we will do, we will take the interval of the 3 years. So in this patient, if the patient has already taken the tetanus before within the 3 months ago, so in that condition we will not give the anti-tetanus injections. Directly what we will give the anti-rabies vaccination. What we will give, the anti-rabies vaccination would be given. See, when we talk about the rabies virus, so rabies virus, what we call this is the rhabdovirus. The rabies virus, we call this is the rhabdovirus, and this is called, or we can call in the simple words, that is the rabies virus. That the rabies virus. So this is what, this is the RNA virus. This is the RNA virus, and this is the helical. This one is the helical capsid, and it is the bullet shaped virus. It is a helical or the capsid and the bullet shaped virus. So always remember, sometimes they can give you the keyword also, that the bullet shaped virus. So always remember, the bullet shaped virus is what, that is a rabies virus or the rhabdovirus. So it is spread by which, by bat. It is spread by the biting of the dog, like by the dog bite, raccoons, by the bats, or like sometimes there is a shrinks also. There is some animals you can remember, that is the shrinks. The dog bite, raccoons, bats, or the shrinks that spread the what, rhabdovirus or the RNA virus. So in the treatment, what we will do, and they affect what, they affect the one receptor. We call those receptor as the nicotinic acetylcholine receptors. The nicotinic acetylcholine receptors, they affect what, the nicotinic acetylcholine receptors. And some in the option, it's in the question itself, they will give you, there is something they will mention about the retrograde migrations. So remember, the retrograde migration, it is seen in which condition? Again, this is seen in the rabies one. And the retrogradely, they migrate to the brain. They affect the nicotinic acetylcholine receptor, and after that they retrograde migrate, in backward direction they will migrate to the brain. And in the brain, if it will affect the brain, the patient will be having the hydrophobia. The patient would be having the hydrophobia. The patient would be having the photophobia. So this is the severe condition that will seen in the rabies patient. And finally, the patients will land up with the paralysis. So in the brain, what bodies we will see in the negri bodies? The negri bodies would be seen. So always remember, if it is the case of the rhabdovirus, so we call the RNA, this is the RNA virus, and it is the bullet shaped virus. It is the bullet shaped virus that spread by the dog bite, affect the nicotinic acetylcholine receptors. What migration they will be have? They have the retrograde type of the migrations, and it will migrate to the brain, and in the brain they form a bodies, they call the negri bodies will be formed in case of the rabies. So Negri bodies, these are seen in which condition? That is the rabies condition. So remember it for the lifetime. This is your very important question for all the exams. So rabies, there is a Negri body. So Negri bodies, remember this is seen in the rabies. And remember that on the brain, on the side, if we talk about the brain, so if it affects the brain, the patient will be having the hydrophobia, the photophobia, the paralysis. If it is affecting the brain, then it becomes very dangerous condition. Maybe you have seen one video was viral about 6 months back about this patient, about the rabies virus patients. So that patient was having the complete hydrophobia. The like somebody was drinking the water, giving the water to him, but he was having the some hydrophobia and the photophobia also. So this is the conditions when when the virus will affect the brain. Okay, so remember these things, all the red points that are really very important for your exam. So what we have to give? So we have to give the anti-rabies vaccination. So vaccination हमने नहीं लिखी, that is the important one. So before what we can do, we can give the vaccine, and vaccine we can give, that is the ARV, and we call this as the anti-rabies vaccine. We can give the anti-rabies vaccine, and we will given a 0, 3, 7, 14, 21. So these are the 5 dose we give at the like when the on the 0 day, like when the dog bite was there, and after that the 3 day, after 7, 14, 21. So these are the 5 doses that should be given as the ARV or anti-rabies vaccination. Okay, in ARV, remember we will be having, there are 2 things again there can be asked. So one we having, that is the pre-exposure. We having the pre-exposures, pre-exposure prophylaxis, and another one we will be having, that is the post-exposure prophylaxis. So pre-exposure prophylaxis, remember before dog bite, what we have to give? Just a vaccine. What we have to give? Just a vaccine. Okay, if the patient, if somebody have the dog and he didn't have, he can have spread the rabies virus. So in that case we can take the pre-exposure, or just a in that condition we will give just a vaccine because of the risk of stray dogs, because of the risk of the stray dogs. Then if the post exposure prophylaxis are there, so post exposure prophylaxis we will do the rabies vaccines series in past. Like for example, if we already taken the pre-exposure prophylaxis before, so in that condition what we will give? We will give the only the rabies vaccine. In that condition we will give the only the rabies vaccine or the ARV. But if the rabies vaccines, like he is not sure about the vaccination that he is taken before or not, if not sure about vaccination, so in that case what we have to do? In past, what we have to do? Of course we have to give the rabies vaccine, but along with the rabies vaccine, what we have to give? We have to give the immunoglobulin also. So both these should be given. And immunoglobulin, what it will do? It will provide the active immunizations to the patient. So if the patient is not sure about the vaccination in the past, so in that case what we will give? The rabies vaccine. Along with that we will give the immunoglobulins. Like for example, we can see here that patient has received the tetanus treatments and living in the rural area, has been beaten in the shin, the wound is superficial, regular vaccination against the tetanus was received 3 months back. What the treatment tactics would be the most advisable in this case? So this what we will give? We will give the anti-rabies vaccination. That will give the anti-rabies vaccination. And if he is not sure about all the vaccination of the previous, if in the question they will mention that anti-rabies vaccination has already been given to this patient, so in that cases we will give the anti-rabies vaccination also, plus we will give the anti-rabies immunoglobulin also. So they will give that option in the exams if that scenario will be there. Question number 27. A 26-year-old woman is suspected to suffer from the systemic lupus erythematosus. So now you understand what is the systemic lupus erythematosus. What should become in your mind? butterfly rash. With the systemic lesion of the skin, vessels, joints, serous tunic, and heart tissue that developed after the photosensitization. The following is detected in the blood analysis. So, in remember that in systemic lupus erythematosus, which cell will be seen? That is the LE cell. Okay, the what cell will be seen? That is the LE cell would be seen in the systemic lupus erythematosus. Antibodies to the native double stranded DNA. So this is antibodies that is present in the against the systemic lupus erythematosus. Antibodies to the native double stranded DNA, and there is lupus erythematosus cell. Isolated anti-centromere body, this is also positive in the case of the systemic lupus erythematosus. Rheumatoid factor is 1 by 100. Wassermann reaction is positive. Circulating immune complex is 120. So remember that in question itself they have given the 2 to 4 question itself. So in SLE, remember, we would be having which cell? LE cell. There would be LE cells would be there. There would be the double stranded DNA antibodies. There will be the double stranded DNA antibodies. So remember the double stranded DNA antibody. This is the positive in SLE. There would be the anti-centromere antibody. There would be the anti-centromere antibody, and Wassermann reaction would be positive. And along with that, remember, there is a circulating immune complex. So which hypersensitivity is this SLE? SLE is which hypersensitivity? Can anyone tell? Hypersensitivity, immune complex.
Type 3.
This is the type 3. Is somebody left the meeting? Okay, so this is the type 3 hypersensitivity. Okay, the immune complex. So this one is the type 3 hypersensitivity. Okay, what immunological indicators are considered to be specific for to this disease? So let's see the options. What the option is asking? Double stranded DNA antibody. See, so they in the question itself they have mentioned that in the SLE we would be having there is antibodies to the native double stranded DNA. Along with that, we have seen there is isolated centromere antibody. Wassermann reaction is positive. Immune complex, the type 3 hypersensitivity is also there. So what immunological indicators are specific to this disease? So remember, this is the specific antibodies. This is the specific anti-centromere antibody. This is the not the specific antibody. The double stranded DNA antibody, this is the specific antibodies for the SLE. Okay, just give me 2 to 3 minutes. I don't have the water, so I will bring the water and we will start. Okay, till then just revise this what we have studied till now.
Okay, till then, tell me about the frostbite classifications. In the type 1 frostbite, which what will be affected? Let me ask somebody. Ria, in type 1 frostbite, which will be affected?
Yes, sir. Type 1 frostbite is hyperemia, epidermis is affected, and erythema and edema.
ठीक है. Then Solomon, what is affected in the type 2 frostbite? Satyajit, in type 2, which one, what will be affected? Type 2 frostbite. Satyajit. Anuj, type 2 frostbite.
हेलो.
हाँ बताओ.
Skin loss, vesicles.
हाँ.
There will be skin loss, large vesicles.
हाँ. एपिडर्मिस के साथ साथ और क्या अफेक्टेड होगा? देखो जैसे इसने रिया ने आंसर दिया ना, वैसे आंसर आना चाहिए सभी का, कि एक लाइन के अंदर तुरंत सारा आंसर हो जाना चाहिए, ताकि मेरे को दोबारा पूछने की जरूरत ही ना पड़े. राहुल, दो राहुल थे ना कल, एक राहुल, सिंगल राहुल. फ्रोस्ट बाइट के अंदर क्या, फ्रोस्ट बाइट टाइप 3 के अंदर क्या होता है? मरियम, टाइप 3 फ्रोस्ट बाइट. अरे तुम पढ़ाई नहीं कर रहे क्या कर रहे हो अभी? तुम्हारा 10 दिन भी नहीं रह रखे हैं.
हेमोरेजिक रैशेस होते हैं और स्किन लॉस.
हाँ, और क्या अफेक्टेड होता है? हेमोरेजिक रैशेज होते हैं, ब्लिस्टर्स होते हैं.
Sir.
ब्लिस्टर्स, वेसिकल्स.
ब्लिस्टर्स. ठीक है. And in fourth degree, the like muscles, bones, or everything will be affected. The necrosis would be there, and the organ will be looks like the black or the grayish color. ठीक है, पढ़ लो यार, बहुत कम दिन बचे हैं. Keep studying hard.
Okay, so let's continue. So remember that in SLE, when we talk about the SLE, there would be the specific antibody would be there, and that specific antibody would be, that is double stranded DNA antibody. Okay, so SLE, remember this is the SLE, that is the systemic lupus erythematosus. So remember that when we talk about the systemic lupus erythematosus, remember this is the type 3 hypersensitivity, and in the type 3 hypersensitivity, remember there will be the immune complex deposition would be there. There would be the immune complex deposition would be there. Along with that, remember the SLE, every one of you know that in SLE what rashes would be seen, that is the butterfly rashes would be seen in case of the SLE. There would be the butterfly rash, and it is associated with the Liebman sac endometritis. There will be the associated, like sometimes they can ask you not endometritis, endocarditis. Sometimes they can ask you which endocarditis is associated with the SLE. So this is the Liebman sac endocarditis. Liebman sac endocarditis, and in this patient, SLE patient, there would be the wire loop kidney will be seen. the patient with their wire loop. So all these are the keywords that you can get in the question. Sometimes you can get in the question, and sometimes they can characterize the butterfly rash, that they will mention not directly the butterfly rash, but they will mention that there is some rashes that present surrounding the nasal regions, and like this, if this is a, and then there is a rashes would be here, and this rashes would be here, and so this is looks like the butterfly rash. This would be looks like the butterfly rash, or sometimes they can give the characteristics appearance of the malar rash also. And in the question they can mention about the wire loop kidney. So remember the wire loop kidney, this is also seen in which condition, that is the SLE. About the antibodies, remember they will be having, there is a anti double stranded DNA antibody, that is the anti double stranded DNA antibody, or we call this antibody another name, that is the anti-Smith antibody. We call this antibody is at the anti-Smith antibody. Okay, and these are they both are the immunological indicator. They both are the immunological indicator. Okay, the anti-double stranded DNA antibody, another name is what? Anti-Smith antibody. The treatment for the SLE, what will give? Prednisolone. The prednisolone will be given. After that, we would be having the next questions. Next question, remember a group of 5 had been resting in a forest. They were drinking alcohol, eating the canned food. So remember the canned food, mushrooms or the cured fish. The next day, 2 of them were hospitalized with a disturbed vision. So what you have seen, there is a disturbed in the vision, the swallowing problem and the respiration. The third one presented with acute general weakness and the dry mouth. The remaining 2 are healthy. A tick was detected on the skin of the one of the healthy group member. So what is the most likely diagnosis? So the most likely diagnosis, if the canned food will be there, so the most, remember that if the canned food would be there, the most likely diagnosis would be, that is the botulism. That would be the botulism. So remember that we have question number 28. The question number 28, we would be having the botulism. We would be having the botulisms. So botulism, remember that it is caused by the Clostridium. It is caused by the Clostridium botulinum. It is caused by the Clostridium botulinum. And what it will do? It blocks the calcium channels. What it will do? It blocks the calcium channels. This is also the very important things, that C4, remember the Clostridium. C4, remember the Clostridium, and C4, remember there would be the calcium channel. So it will block what? It will block the calcium. It will block the calcium channel. So if it will block the calcium channels, what will be there? There is a no release of acetylcholine. There would be the no release of acetylcholine. I hope every one of you know that we would be having the neurons, and then between the 2 neurons we would be having the synapse, like the gap present between the 2 neurons. And if there is a from the neurons we would be having the neurotransmitter would be released, that is the acetylcholine, and in between we would be having the release of the calcium ion. If the calcium ion would be blocked, so the calcium ion, they help in the release of the acetylcholine. So if the calcium ion would not be there, there is a no release of the acetylcholines. So Clostridium botulism, they will block the calcium channel, and due to which there will be the no release of acetylcholine. If there is a no release of acetylcholine, acetylcholine is what? It is the parasympathetic neurotransmitter. So what it will do? It will cause the muscle relaxation. So in that these patients, there will be the no muscle relaxation would be there. There will be no muscle relaxation, or the no muscles movement would be there. And when the no muscles movement would be there, the patient will end up with flaccid paralysis. The patient will end up with flaccid paralysis, and the patient would be having, if the muscles would not able to relax, the problem in the swallowing, and we call this a condition as the dysphagia. We call this condition as the dysphagia, or the patient can having the double vision. The patient can have the double vision as well. Remember that when we talk about the Clostridium botulinum, the Clostridium botulinum, remember this is the gram positive or gram negative. This is the gram positive bacteria. This is the gram positive bacteria, and this is the anaerobic. This is the anaerobic, and this is the spore forming. This is the spore forming bacteria. Remember these 3 points, very important. This is the gram positive bacteria, the anaerobic bacteria, and the spore forming bacteria. Gram positive bacteria, what they release the toxins. We call that toxin is the exotoxin. We release that is the exotoxin, and this exotoxin will be present in the honey, canned food, honey or the canned foods. Okay, and if there is a, what they will do, they block the calcium channel. So if it will block the calcium channel for the long time, so the patient can land up with the respiratory arrest. The patient can land up with the respiratory arrest. Okay, so remember that the botulism, it is caused by the Clostridium botulinum, and we would be having the gram positives, and this is the anaerobic bacteria, this is the spore forming bacteria. What it will do, it will block the calcium channels, and if it is block the calcium channel, there is no release of the neurotransmitter acetylcholine, so no muscles movement would be there, and the patient will be having the flaccid paralysis. And the flaccid paralysis, along with that the problem in the swallowing, the dysphagia would be there, and the double vision would be there, or double vision we call the diplopia. The patient will be having the diplopia. Okay, for the treatment also, remember the treatment what we will give is the anti-botulinum serum. The treatment we will give the anti-botulinum serum would be given, or we can give the antibiotics. Which antibiotic can be given? That is the streptomycin. There would be the streptomycin. So streptomycin would be given. ठीक है, एंटी बोटुलिनम सीरम और द एंटीबायोटिक द स्ट्रेप्टोमाइसिन. The same is written in the question. The canned food we would be having the exotoxins, and they disturb vision, swallowing, and the respiration, because in the respiratory we have the loads of the muscles. That muscles will be disturbed, and once the muscles will be disturbed, there is a problem in the respiration. And third one, present with the acute general weakness, the dry mouth. The remaining two were healthy. A tick was detected on the skin of one of the healthy group members. So what is the most likely diagnosis? So what is that? That is the botulism. That is the botulisms. Okay. देखो अभी now we have the, today we would be having third. Okay, so 4 5 6 7 8 9 10 11 12 13 14 15 16. ठीक है, कितने हो गए? 13 days. You have just 13 days left, and no one of you will take these things lightly. If you take everything lightly कि यार हो जाएगा, है ना, I will make it anyhow. If you'll study just the test center, I will make it happen. Maybe you can do it, but believe me, this is, you have to give your 100%. You have to take that 1% chance also of the failure in your mind. The 90%, 99% you should be the positive, but 1% you should be the negative also. And don't be like heavy, don't be like heavier. That 1% should not be heavier than your 99%, but it should be in your any of your corner of your mind, that if no, I will not able to make it. That should be in your mind, so that you can push yourself as much as possible. Don't take anything at light. I'm getting the 95% in the test centers, nobody can stop me this time. Nobody, believe me, those who are getting the 100% in the test center, they will also fail this exam. Why they failed this exam? Because they did just the rectification of the, or they just mug up all the question from the test center. That's why I'm saying. And in the final exam they didn't get anything. And in the Krok one exam also, somebody got the questions, like there was a 100, I think 100 100 variants was there, and in 100, in each question paper there was a different paper. There was a different question paper. Somebody got the 20 question from the test center, somebody got the 70 question from the test center, somebody got the 100 question from the test center, somebody got 10 20 40. Everyone has a different question paper. So you should be have, it can be the easy, it can be the hard, any exam can be there in the second attempt, but please make sure that anyhow you have to clear these exams, and for that you can't take it the light. Be it like you have to work hard for it. Don't think that I will make it anyhow. If I will not study, I will make it happen, the paper would be the leak, so I will get the paper. Maybe you will not get the papers, or you got the papers. In both cases you have to be ready. You have to give yourself the best things whatever you can. This is the time, the 13 days are like, believe me, more than enough if you study from today itself. Yesterday I also said the same things, but today again I am saying the same things. If you will study the every day, 13 multiply 10, every day 130, it would be the 130 hours. So you are getting the 130 marks. It means that you can do it. Still only I think 4 or 5 people send me the screenshot of the 95%. What about others? What you are doing? You are waiting for any miracle to happen, your paper. I don't know what you are waiting for, but you should have to complete that target. Whatever the, like, every day you have to do minimum one question from the test center, one question paper from the test center with correct concept. ऐसा नहीं करना कि rectification करना है. Don't do the just mug up those questions and think that this paper will be come in the exams. Cross your limits. Cross your limits. If you think that you have worked hard today, just give yourself 5 more minutes, and again say that give again 5 more minutes, again 5 more minutes, and it will be, can be the 1 hour or 2 hour or 3 hours you can increase. Whenever you think that you are tired, give yourself 5 more minutes, and every time when you will think once the 5 minutes has been completed, give again yourself the 5 minutes for study. Maybe those 5 minutes can save your life, है ना? So do it properly. Just avoid everything for just these 13 days. I'm requesting you, everyone, don't go be here and there. Don't just enjoy the life. You will enjoy the life more than if you pass these exams with the great marks, or if you will pass these exams, you will be graduated. Definitely there would be you will enjoy this hard work that you will put in these 13 days. Whatever the hard works you will put in these 13 days, definitely you're gonna enjoy these days, and you will remember these days that I have worked hard for these 13 days, and you will proud yourself, and you will be motivated by yourself only for the next exams, or for whatever you will prepare for future. And so don't take it as light. Cross your limits as much as you can. Okay, question number 29. A 23-year-old man complained of the facial edema, headache, dizziness, low urinary output, urine discoloration. These complaints arose after the patient had a case of the acute tonsillitis. So you can see that this patient is having the acute tonsillitis are there. On examination, there was the facial edema, the skin is pale, temperature is there, blood pressure is there, heart sounds are muffled. The second heart sound is attenuated over the aorta. What etiological factor is the most likely in this case? So if we will be having the group A beta hemolytic streptococcus, so in that case patient will come with the pharyngitis. Now usually the pharyngitis or the tonsillitis, it is caused by the group A beta hemolytic streptococcus, that is GAB. So this one is the, just for examples like GABHS, group A beta hemolytic streptococcus. Group A beta hemolytic streptococcus. The group A beta hemolytic streptococcus, remember, this is patient will come with the history of the tonsillitis, or the patient will come with the history of the pharyngitis. After 1 week, what you will see, their patient can have the, like, this bacteria what it will cause? It will cause the molecular mimicry. What it will cause? The molecular mimicry. In our heart, we would having the one protein that is called the M protein. So what it will do? It will mimic like that M protein. So that M protein will be formed, and this M protein will be formed. It will mimic the protein that is present in our heart, or it can present in our joint also. So if it is present in the joint, or it will mimic the M protein that is present in our joint, so it will cause the rheumatisms. It will cause the rheumatisms. Or there is another mechanism of this, like the patient come with the tonsillitis or the pharyngitis, the group A beta hemolytic streptococcus, there is an antigen would becomes, and due to that antigen there would be the immunoglobulins, or the antibody will be formed, and that antibody will be accumulated in the joints, and that will cause the rheumatisms. Another things they can do, that they can cause a scarlet fever. They can cause a scarlet fever. In the scarlet fever, I hope every one of you know what kind of the tongues you will see. The strawberry tongues, or the crimson red or purple tongue, या फिर sometimes they can write the purple tongue also. So crimson red or the purple tongues, we call this as the strawberry tongues. We call this as the strawberry tongue would be seen in case of the scarlet fever. The scarlet fever. After that, they can also cause the rheumatic heart disease. They can also call this the rheumatic heart disease. And the rheumatic heart disease, the most common they associated with the valvular heart disease, that is the mitral stenosis. That is the mitral stenosis. And they can also cause the rheumatic fever. They can also cause the rheumatic fever. And rheumatic fever, I have shared the video also in the rheumatic fever, and we have the criteria to diagnose the rheumatic fever, that is the Jones criteria, and that is, we will see there is a S of bodies. Remember that in rheumatic fever we see one bodies, that is the S of bodies would be seen in case of the rheumatic fever. If this immune complex will be deposited into the post streptococcus, or like in the kidney, so they will cause the post streptococcal glomerulonephritis. Post streptococcal glomerulonephritis. And remember that in this post streptococcal glomerulonephritis, what you will see, the cola colored urine. What you will see, the cola colored urine would be seen, and the patient will be having the hematuria. The patient would be having the hematuria. Okay, I'm repeating it again. The patient has come with the tonsillitis, the pharyngitis, and this patient have the infection of the group A beta hemolytic streptococcus. So after 1 week, what you will see, the patient has the antigen has been entered into the body. So after that there would be the some antibodies formation by the body that will mimic the protein that is present in our body. They will call this as the molecular mimicry. And this M protein formation, or you can say the antigen antibody complex, it will be deposited in the joint, that will cause the rheumatic fever. And the S of bodies, if it will be accumulated in the joints, it will cause the rheumatisms. If it is accumulated in the kidney, it will cause the post streptococcal glomerulonephritis. In post streptococcal glomerulonephritis, remember there will be the cola colored urine, and the hematuria would be there. There it can lead to the scarlet fever also, where we will see the crimson red or the purple tongue, and it can also cause the rheumatic heart disease, that will cause the mitral stenosis. Okay, so these all are the important things that you have to remember. So here this is the simple, like if the question coming with the acute tonsillitis, or they have the history of the acute tonsillitis, or the patient having the acute pharyngitis, along with that you will see there some heart problem would be there, like second heart sound is attenuated over the aorta. So the most likely etiological factors is what? That is the beta hemolytic streptococcus, GABHS, group A beta hemolytic streptococcus bacteria. Question number 30. We were doing the examination. A 4-month-old child with the meningococcemia presented with the acrocyanosis, cold extremity, tachypnea, and the thready pulse, blood pressure of 30/0, and inuria the suffer. What clinical syndrome it is? So see, we having the one things that about the meningitis. We would be having the meningitis. And when we talk about the meningitis, remember we would be having it can be the bacterial meningitis, There could be the bacterial meningitis, there can be the viral meningitis, and there can be the tubercular meningitis. There can be the tubercular meningitis. So remember that if the bacterial meningitis are there, that is caused, of course, I hope every one of you know the when you talk about the meningitis, which is the most common things, that is the which bacteria? It is meningitis is caused by which bacteria? Meningitis is caused by which bacteria? अच्छा चलो, तुम बताना नहीं चाहते होगे, ठीक है, ताकि मेरे को कुछ पता चल जाए,
Neisseria कौन है?
मिल जाए, है ना. So it is caused by the Neisseria meningitis. It is caused by the Neisseria meningitis, and it is what? It is the gram-negative bacteria. It is the gram-negative bacteria. Okay, what in we will see in case of the bacterial meningitis, there will be the decreased glucose. There will be the decreased glucose in the cerebrospinal fluids. What it will do? The bacteria, they love the glucose. So what they will do in the CSF, in the brain, cerebrospinal fluid. This is the fluid that is present in the brain or the spinal cord. So what it will do? They will eat the glucose. So when they will eat the glucose, what you will see, there is a decrease the glucose level in the cerebrospinal fluids. They will decrease the glucose in the cerebrospinal fluids, and due to which, if the bacterial infection are there, so there will be the increase in the neutrophils amount would be there. The neutrophils will be predominant. So the increase in the neutrophils, there will be the increase in the neutrophils. Of course, if it is a bacterial infection, so there can be the chances of the sepsis also, and the patients can also having the hemorrhagic rashes in the skin. The patient can also having the hemorrhagic rash in the skin, and what it will do, it will shut down the adrenal glands. What does the shut down the adrenal glands? What we call this condition? Can anyone tell what we call this condition? Shut down the adrenal glands. The first word I will tell, water. बताओ भाई. Waterhouse-Friderichsen Waterhouse-Friderichsen syndrome. Okay, or sometimes we can call it this as the toxic shock syndrome also, the toxic shock syndromes. So in this condition, what you will see, there will be the anuria would be there. Anuria would be there means no urea will be there, and the decrease in the blood pressure would be the decrease in the BP would be there. So for the diagnosis, what you will do, the bacterial meningitis diagnosis, we will do the lumbar punctures, and in the lumbar punctures, what you will see, that will the pus would be seen. There would be the pus. So when we will make the diagnosis, so when we will do the diagnosis, remember there will do the lumbar punctures, and remember that lumbar puncture would be done at which lumbar vertebra? L3, L4. We do the L3, L4s. So when we will do the lumbar punctures, we will see there will be the purulent. There would be the purulent would be there. Purulent means pus would be seen in case of the lumbar puncture, and this purulent or the pus, it will be looks like the turbulent. It is the turbulent or cloudy. It will looks like the turbulent or the cloudy. Okay, so this is what we call the bacterial meningitis. In viral meningitis, remember there will be the glucose levels. So in viral meningitis, what would be there? The glucose level would be the decrease or increase. The glucose level not be affected. So glucose level would be same. And there will be the increase, because this is the viral infection. Remember, in the viral infection, there would be the which cell would be increased, that is the lymphocyte would be increased, and there will be the decrease in the WBC level, and the CSF, remember, that would be the clear. The CSF would be looks like the clear. In tubercular meningitis also, the lymphocytes would be increased. In the tubercular meningitis also, the lymphocytes would be increased, and the glucose level would be decreased. And in the tubercular, remember, there will be the fibrin film deposition. The fibrin film will be deposited in case of the tubercular meningitis. Okay, I'm repeating it again. The bacterial meningitis, what you will see, the decrease in the glucose level, because the bacteria, they love the glucose, And there is Neisseria meningitis, the gram negative. They are caused by the Neisseria meningitis, gram negative bacteria. They increase the neutrophils predominant, the sepsis, hemorrhagic rashes, shut down the adrenal glands, and they will cause a water howl fluorescence disorders. When the CSF will be looks like the cloudy or the turbulent. Then we will be viral. What you will see, the increase in the lymphocytes level, glucose level would be normal. In tubercular also there would be the glucose will be decreased. The glucose level would be decreased. Remember here the more decrease and here the less decrease. Then lymphocytes level would be increased in the tuberculars, and there will be the fibrin film deposition would be seen. Okay, so this is what that is about the meningitis. भाई समझ आ रहा है, ऊपर से जा रहा है? Are you understanding? Hello, are you there? अजीम, अब्दुल, मरियम, कुपुश, अमी, सुलभ कुमार क्या कर रहा है? लेफ्ट हो रहा है, बार बार ऐड कर रहा है. ठीक है,
स्लाइड आई है.
ठीक है. So this having the examination, what we have seen, the meningococcemia is present with the macrosinuses, cold extremity, tachypnea, thready pulse, blood pressure 30/0, anuria. So what you have seen, the anuria and the swell. The patient with the meningococcemia has developed there is a decrease in the blood pressure. So what you have seen, there is a decrease in the blood pressures, anuria, and the patient would be having the like bacterial infection. So bacterial infection there can lead to the pus involvement, or the sepsis can be there, and that can lead to the septic shock. Okay, the bacterial involvement that usually that will end up with the septic shock, and in the shock what you will see, there is a decrease in the blood pressure, and of course there will be the absence of the urine, and the patient will go into the coma stage, or unconsciousness would be there. The 31, the pregnancy is full term. The body weight of the parturient woman is 62 kg. The fetus is the longitudinal lie. Now you can see the fetus is what? It is the longitudinal lie. The head is engaged to the pelvic inlet. The belly circumference is 100 cm. Uterus fundus. What body weight of the fetus can be suspected? So for calculating the body weight, what we have to do? Okay. Treatment also. The treatment is what? The treatment for the in case of the meningococcemia, remember, we will give the, here you can write the treatment for the meningococcemia. You can give the ceftriaxone, or sometimes they can write the ceftriaxone or the cephalosporin, or they can also write the third generation cephalosporin. Okay, so ceftriaxone is what? It is the third generation cephalosporin. Then in the question number 31, how you will calculate the blood? So for calculating, remember we were having the formula. Okay, so this you can write like we would be having. So this is what formula. So what you have, the body area and multiply the fundus size. So this is the normal things, like the full term baby 37 weeks to 41 weeks plus 6 days, and we will be having the body weight. So how we will calculate the body weight of the fetus? That is the body area circumference multiply the fundal height. So we would be having here 35 multiply the belly circumference is 100. Your fundus height is 3500, so it will be around 3500 and gram, and it will be in the kg, that is the 3.5 kg. Okay, write it down. The body weight of the fetus, it is equals to the belly circumference multiply the fundal height. Belly circumference multiply the fundal height, and that is what? The 3500 gram, and here then the kg, it will be the 3.5 kg. Okay. Next question is what? That is X. Okay, the next question is an 18-year-old young man complained of the knee and the elbow joints and the temperatures. On examination, the body temperatures, swelling of the elbow and the knee joints. The pulse is 106, rhythmic, blood, cardiac burden changed, and soft systolic murmur. So what is that? The anti-staphyliation. No. So okay, so once you will do the rheumatology questions, you will get this question. Then question number 33 is also about the meningitis. Do it's clear? The fluid is clear. So what is that? The tuberculous meningitis. Then question number 34. The question number 34 we would be having increase the spastic spasm. So remember that if you are having the increasing in the spastic pain in the lower abdomen that occur after the emotional stage. So any factors like the stress conditions or the emotional conditions, so it all they are associated with the irritable bowel syndromes. Bowel movements are intermittent. Usually you will see the 2 to 3 defecation after waking up in the morning. Alternate with the constipations. Body mass is retained. Palpation on the sigmoid colon. Sigmoid colon means mainly there is the large intestine that will be the affected, and the painful due to the spastic condition in the intestines. In the irritable bowel syndrome you will see the spastic movement will be there, and the mucosa will not be involved. Lumen contain a large amount of the mucus. What is the most likely diagnosis? So the beauty of the Krok 2 question, sometimes, not all the times, but most of the times they will give in the question itself everything about that topic, so that they already gave the everything about the topics. You have to just choose the answer, that is the irritable bowel syndrome. These are all the clinical features they are given. For example, the first things that is increasing the spastic pain. So the in spastic pain you can see from the option itself. The malabsorption system you will not see. The ulcerative colitis, the Crohn's disease you will study, then you will understand what is the difference between them. Then the spastic, remember when the spastic things, the stressful condition, the spastic one, spastic pain, spastic stress, emotional condition, mainly the large intestine usually. Increase of the mucus. Okay, so all these are what? And one more thing, that is the this is the painful conditions like spastic pain. So all these are associated, like mainly they will give you the question the stress things or the emotional things. So all these are the symptoms that all these are the causes that we will see in the patient with the irritable bowel syndrome. The question number 35, the inpatient surgery unit has introduced the method of the laparoscopic cholecystectomy into the practice. As a result, the average duration of the post-operative care provided to the patient could be reduced to the required after non-laparoscopic cholecystectomy. What method of medical can confirm the statistical significance of the two different estimation? Okay, so this you have to remember. This is the hygiene question. So remember that I hope did anyone watch the video of the hygiene last attempt? ये क्या चल रहा है? मैं जब भी whenever I was seeing the Google Meet, then somebody left the group, somebody is joining, somebody lefting. क्यों हो रहा है ऐसा?
नेटवर्क इशू है, नेटवर्क इशू।
भैया वो इलेक्ट्रिसिटी बहुत ज्यादा कट रहा है।
हाँ,
इलेक्ट्रिसिटी पावर ऑफ हो रहा है बार बार, लगभग 13-14 घंटे काट रहा है।
oh 13-14 hours. Okay, so what you have to do, just whenever the hygiene, I also send you the one base question PDF, so you can go through the hygiene those base questions every day. If you will do the around 10 or 15 questions, then you will be able to finish in these 13 days, and do revise that hygiene video. For the hygiene question, whenever you will do the test center question paper, so please try to make sure that you take the screenshot of all the hygiene questions, and in the last revise all those questions only. And there is nothing new you have to add in the hygiene, because hygiene is a very big topic, and we don't want to study for the hygiene for the Ukraine itself, and that will not help in your future also, because this is the like community medicine of the Ukraine. So this is everything they can ask from the Ukraine. So this is not that about the base directly they can ask. Every time I'm seeing that there is some new question would be there for the hygiene. So don't worry about the hygiene just I think 5%. There is nothing you have to worry about the hygiene. So if some question would be there about the incidence, prevalence, and some question would be you can get on the hygiene about the pneumoconiosis. Okay, that is also including in the hygiene topic. So just revise all the questions from the test center. If you're not able to understand anything in the hygiene, do it, mug it up. Okay, if in this question, what method of medical state confirm the for confirmation of the statistical significance, remember, and we have to if we have the two estimations. So for the difference of the two estimation, what we will do, we will take the calculate the student confidence intervals. Okay, and sometimes they will write the students T correlation something. Okay, so you have to remember the students here, the students confidence interval. Then the question number 36, a 37-year-old worker during the fire. Now this is the again easy question. Now you can see there is a old worker is there on the fire, ended up in the area of high carbon monoxide concentration. So he was delivered to hospital in the unconscious state. The skin of his face and the head is in the crimson, hands is crimson means red. Respiration rate is the 20 means that is the normal. Alternation specific for hypoxic myocardium, hourly diuresis, color index ESR, carboxy hemoglobin. What criteria allow to determine the severity of the patient condition? So if the patient who is working under the fireworks or vehicle or the vehicles with like coal particles or working in the coal workers also sometimes. So what will they will be have the fireworks or the closed room are there. So in the closed room what will be there is an increased amount of the carbon monoxide. There will be increased amount of the carbon monoxide. So what you will see here that in this question, in blood what you will see the hemoglobin plus oxygen. Usually what you will see the hemoglobin combined with the oxygen, but hemoglobin can also combine with the carbon dioxide, hemoglobin can also combine with the carbon monoxide, hemoglobin can also combine with the nitrates. If hemoglobin combined with the carbon dioxide, we call this condition as a carb amino hemoglobin. We call this condition as a carb amino hemoglobins. But if the and this is the reversible condition, when the more oxygen will come, when there is oxygen amount would be increased, so this will be reversed, like oxygen will be bind with the hemoglobin. But hemoglobin when it hemoglobin combined with the carbon monoxide, we call this condition as the carboxyhemoglobin. We call this condition as the carboxyhemoglobin. So carboxyhemoglobin, remember, whenever the carbon dioxide have the more affinity to bind with the hemoglobin than the oxygens, like it will be the, I think 250 times more affinity to bind with the hemoglobin than the oxygens. And this is very more stable than hemoglobin, like oxyhemoglobin, that is more stable than the oxyhemoglobins. And we will see, like if the fire workers are there or the vehicles, like the smokes of the vehicles, you will get the loads of the carbon monoxides. Along with that, hemoglobin it combined with the iron also, and if there will on the oxidation it will form the Fe3 positives. So if the patient is taking watermelon, nitrates, or the patient like paints worker, those who are doing the paints, and the chemicals like the toluene, so all these will be having the Fe2 positive will be converting to the Fe3 positives, and this patient will be having the methemoglobin. We call this patient having the methemoglobin. And the antidote for the methemoglobin, remember what is the antidote for the methemoglobin? That is the methylene blue. Okay, so remember that when hemoglobin combined with the carbon dioxides, we call this condition as the carb amino hemoglobin. When oxygen will be there, that condition can be reversed. If the hemoglobin combined with the carbon monoxide, we call this condition as the carboxyhemoglobin. And the carbon monoxide, this is seen in the fire workers, the vehicles, smokers. And when the hemoglobin it combined with the iron, and normally what you will see, the iron is present in the Fe2 positive, but whenever we are eating the more watermelon, in watermelon also there is the nitrates, the more nitrate consumptions, the more paint workers and the toluene. So all these what they will do, they convert the Fe2 positive into the Fe3 positives, and if Fe3 positive will be increased in our body, we would be having the methemoglobins. And because see, usually also what we will see, Fe2 positive will be converting into the Fe3 positives. What if you are eating the less watermelons, like not so much watermelon, excessive watermelon, so we would be having the one enzyme here, okay, that is the iron reductase. So again, if the few iron will converting into Fe3 positive, the iron reductase will again convert them into the Fe2 positive. But again, if you are excessive watermelon, the iron reductase will be having the less sufficient, and that due to this less sufficient, more Fe3 positive will be increased in our body, and that will lead to the methemoglobin, and for that we will give the antidote, that is with the methylene blue. Okay, so in this question we would be having the worker during a fire, the carbon monoxide concentration. For what criteria allow the determine the severity of the patient condition? So this is the carbon monoxide plus hemoglobin, and we call this condition as the carboxyhemoglobin concentration. Okay, is that clear? मैं तो नहीं. Okay, the next one, we would be having the right arm of the newborn is stretched along the torso with all its joint extended, the shoulder is rotated inward while the forearm is pronated. थोड़ा सा fast चलते हैं, let's go little fast. So when we talk about the brachial plexus, okay, write down little fast. Brachial plexus, we would be having the upper and the shoulder, upper or the superior trunk, upper or the superior trunk, and we would be having the lower and the inferior trunks, lower and the inferior trunk would be there. So if the upper trunk would be affected or the upper roots would be affected, like in brachial plexus we have the what was that, C1, C2, C3, C4, कितना होता है, C5, C6, C7, C8, T1. Okay, these are the nerve roots. So in upper we would be having the C5 or the C6 root will be affected. So if this nerve root will be affected, we call this condition as the Abs palsy. There would be the Abs palsy. So remember, in the Abs palsy, arms abducted, elbow extended, arms abducted, elbow extended, and forearm pronated, forearm pronated. So revise it 2, 3 or 4 times. That arm extended, arm abducted. There in the question itself also we would be having the forearm is pronated, the shoulder is rotated inward, the head in the position of the palmar flexion. So what you will see, remember that arms abducted and elbow extended and the forearm is pronated. So we call this as the doll's arm appearance. We call this as the doll's arms appearance. So remember again, repeat it again, arms abducted, elbow extended, forearm pronated. एक मिनट रुको, मेरे को लग रहा है आर्म्स अबडक्टेड. ओके, सो दिस इज द अडक्शन. देयर इज, हाँ ऐसे होगा ना, तो आर्म अडक्शन विल बी देयर. ठीक है, so this is the arm adduction. So arm adduction, elbow extension, and the forearm pronation. Arms adduction, elbow extension, forearm pronation. Arm adduction, elbow extension, forearm pronation. So what the new root value will be affected, that is the C5 for the C6, C5 for the C6 would be affected. Then if the inferior or the lower trunk would be affected, so we call this condition that it will be the C8 or T1 will be affected. And the C8 T1, remember this we call the Klumpsky palsy. We call this condition as the Klumpsky's palsy. So in the Klumpsky palsy, remember what you will see, the ulnar nerve would be damaged and there will be the no gasping reflex would be there. The ulnar nerve would be damaged and no gasping reflex would be seen. No grasping reflex would be seen in this patient. Okay, so this is what, that the inferior lower extremity we call the Klumpsky palsy, and upper superior we call this is the Ubbs palsy. Okay, so this is what we have seen. Newborn is sat along the torso with all joint extended, the shoulder is rotated inward, the forearm is pronated, hand in the palm of the palmar flexion, spontaneous movement are absent in the shoulder and the elbow joints, passive movement are painless. So it is what, that is the Duchenne-Charles palsy superior proximal type, because it involves the only the proximal one, it doesn't involve the distal one, so that's why it is the superior proximal type. Then after that we would be having in April during the medical
notes दिखाना
examination of various population, we would be seeing that the gingival that bleeds when pressed, hyperkeratosis follicles not accompanied by the skin dryness. So yesterday we have discussed about that there is the gingival bleedings, the problem in the gums. So we call this condition as the due to vitamin C deficiency. This is due to vitamin C deficiency. Okay, and we call this condition as the scurvy. In 1 year old child with the case of the URTI, the URTI are there and there is a children, so always thinks in the favor of the croup or the stenosing laryngotracheitis. But then read the question. Suddenly develop the noisy respiration. Noisy respiration means the stridor are there. In this patient we will see the stridor. Sometimes they can give the inspiratory stridor also. The inspiratory stridor. With the difficulty in the inspiration, intercostal retraction and the barking cough. The barking cough means croup. On the second night after the disease onset, so we call this condition as the stenosing laryngotracheitis. The URTI are there. The URTI, remember, that is the URTI. In the URTI, we would be having the stenosing laryngotracheitis. Now see, sometimes they can give the stenosing tracheitis also, and sometimes they can give you the stenosing laryngobronchotracheitis. All are the same. And what another name of this condition, we call this as the croup. We call this condition as the croup. And this is caused by the virus, that is the parainfluenza virus. That is caused by the virus, that is the parainfluenza virus. There would be the labored breathing, inspiratory stridor and barking cough. Labored breathing, inspiratory stridor and barking cough would be there. Barking cough would be there. Okay, so this is the scene in case of the URT, stenosing laryngotracheitis. Stenosing laryngotracheitis, what you will see, that is caused by the parainfluenza virus. What you will see, the labored breathing, inspiratory stridor and the barking cough would be there. Okay, this is again very important one. Then we would be having the noisy stridor, or sometimes you can give the noisy respirations. Okay, the noisy respiration would be there. Stridor meaning is stridor means that this is the noisy things. So noisy respiration would be there, and we call this is the stenosing laryngotracheitis. Then question number 40, a 46-year-old woman complained of the severe pain attack in the right lumbar area which radiate to the lower abdomen, and the nausea are there. So pain where in the right lumbar area, right lumbar area. Okay, assume what is the right lumbar area. Then after that, what you see, this kind of the pain attack has never detected in the patient before. So in, remember what is present in our lumbar area? Of course, kidney. In the patient before, the plain abdominal X-ray reveals no pathological syndrome. Ultrasound detect hyperechogenic. There is a direct question. Hyperechogenic mass is in diameter, which reflect the sound waves in the large right renal pelvis. Hyperechogenic means on ultrasound, if stone will be looks like the hyperechogenic mass. The stone will be looks like the hyperechogenic mass. means it looks like the white color on ultrasounds. So this is what, that is the renal calculus, means renal stone are there. Okay, this is the renal stone. So if you see the pain in the lumbar area, remember, if in the question you will get the pain in the lumbar area. If there is a pain in lumbar area, pain in the lumbar area, we call this as the, or we can call this condition normally lumbalgia. So it, or sometimes they can give you along with that they can give the costo-vertebral angle tenderness. Costo-vertebral angle tenderness. Costo-vertebral angle tenderness can be there, or we call this condition as the Pasternetsky sign positive. We call this condition as the Pasternetsky sign positives. So we can suspect if this condition are possible. Pasternetsky sign is positive in which condition? Pyelonephritis. And also remember, this is also positive in the kidney stone. So we can assume the two conditions. The first one is the kidney stone, and another one that we can assume, that is the pyelonephritis. We can assume that is the pyelonephritis. So remember that in kidney stone, what you will see, the colic or the lumbar pain would be there. The colic or lumbar pain will be there, and there will be the fresh RBC. There will be the fresh RBC will be seen in the urine. Sorry. So there will be the fresh RBC in the urine. Fresh RBC in urine. And that will be the, like when you will see that patient on the ultrasound, so it will be looks like the hyperechogenic. That patient, it will looks like the hyperechogenic. But in pyelonephritis, remember, in pyelonephritis, firstly it is caused, acute pyelonephritis, it is caused by the E. coli bacteria, and it will, what you will see in the urine, the WBC will be seen in the urine. The more WBC in the urine, that is the pyelonephritis. More RBC in the urine, Pasternetsky sign negative. If the Pasternetsky sign is negative and there is a more RBC in the urine, we call this condition as the, which one? Glomerulonephritis. We call this condition as the glomerulonephritis. Okay, so this is a hyperechogenic mass. So we have seen already, that is the renal calculus. Then nothing you have to search more. Okay, till here. Always remember, whenever the sound, like if the stone are there, the stone will be looks like the hyperechogenic. But in the cancer, you can also write it here, that if the stone we are looking on the ultrasound, so the stone on ultrasound, remember, that will looks like the hyperechogenic. The stone will looks like the hyperechogenic. And if we talk about the some cancer thing, so in the cancer, if the some cancer would be there, the sound wave will be absorbed in case of the cancers, and the cancer, it will be looks like the hypoechogenic. There will be the hypo. In ultrasound, we see the three colors. One, the whitish color. Ignore the three color basically. There we will see the from black to the white, black to white color. In black to white color, there is a dark black, then the less dark, more less dark, more less dark, more less dark, then gray color, then less gray color, more gray color. So there is some shading would be there from black to the white, and there is the more darker white, less dark white, everything, all this, these are shades from black to white you will get in the ultrasounds. So the stone will be looks like the hyperechogenic, more whiter. In the cancer, what you will see, the sound wave will not be absorbed, so that will be looks like the hypoechogenic. Pyelonephritis, there will be the more WBC or the leukocytes in the urine, and in case of the glomerulonephritis, there is the more RBC would be in the urine. In case of the kidney stone, remember, there will be the fresh RBC will be seen in the urine. Okay till here? अरे कुछ बोलो भाई, कुछ सुनना ही नहीं दे रहा तुमरा.
करेक्ट, परफेक्ट.
Okay, समझ आए यहाँ तक? Who is sleeping and who left the meeting? Those who will not come from tomorrow, like you, if you have missed the 2 classes, you will not able to enter for the next class, because if you can't be serious, why should I be serious? Then question number 41, a 60-year-old woman complains of the unbearable pain in the light subcostal area. So I hope every one of you know about the abdominal area. Everyone gives me thumbs ups if every one of you know already. Abdominal Sulabh, okay. Azim, Ria, who is that? Kupusami, Mariam, Anuj. Okay, every one of you know. Solomon, do you know what all the abdominal regions? Okay, everyone open your mic. Sulabh, hello.
Hello, hello.
Azim, Abdul, hello. Just say
Hello,
hello.
hello.
Mariam,
Hello.
Ria,
Hello, sir.
Kupusami,
Hello, sir.
Satyajit, Anuj,
Yes.
Solomon, are you here? Johnson, तो फिर मैं हिंदी में पढ़ाता था. Okay, so what is that? We would be having, that is the pastor WBC in the urine. So what would be the pyelonephritis? We would be having the E. coli and the WBC in the urine. The ultrasound we would be having, that is a stone. The stone hyperechogenic and the cancer would be the hypoechogenics. So what you'll see, a 60-year-old woman complains of the unbearable pain in the right subcostal area. तो right subcostal area के अंदर हमारे पास क्या होता है? In right subcostal area, right subcostal area. She had the history of the acute pancreatitis. Temperature is 38. So already what you have seen, they have the history of the acute pancreatitis. Her sclera was icteric. There is no sign of the peritoneal irritation. No sign of peritoneal irritation. It tells us about there is no peritoneal injury. The Oatner's and the Guber-Gatus symptoms are positive. Urine diastase is 320 unit per liter. So if the urine diastase is 320 per liter, so remember that this is the exacerbation of the chronic pancreatitis. Okay. So if remember that, so that if the diastase means there, that is the exacerbation of the chronic pancreatitis. This is positive in the case of the positive in case of the chronic pancreatitis. When we talk about the pancreatitis, remember that we would be having the pancreatitis. The pancreatitis, remember, there would be the acute pancreatitis and there would be the pancreatic cancer. There would be the pancreatic cancer. So acute pancreatitis, remember, there would be the gray Turner sign would be positive. So in acute pancreatitis, there would be the great Turner sign positive. Gray Turner sign would be positive. There would be the pain in epigastrium. There would be the pain in epigastrium would be there. That is relieved by, ये very important है, this is very important, relieved by leaning forward. This is the relieved by leaning forward. Okay, and there will be the Cullen signs. ठीक है, Cullen sign. So there are the two signs that you will see, the gray Turner signs, and the second, there is a pain in the epigastrium that relieved by the leaning forward, and this is what, that is the Cullen sign. No, this is not the Cullen sign, but there is another sign that you will see, that is the Cullen sign. Then remember that these three things, that is the pain in the epigastrium that is relieved by the leaning forward. You can just imagine that this is talking about the acute pancreatitis. They are talking about the acute pancreatitis. Then there is one other thing, that is the pancreatic cancer. So remember, in the pancreatic cancer, there will be one sign is positive, that is the core vicious signs. There is the core vicious sign, that is the positive. And what will see, the pancreatic cancer head. This I see pancreatic cancer head. Just remember the name, the coarse visual sign, and other things you have to remember. There in pancreatic head, you will sometimes you can see the gallbladder obstruction. There will be the gallbladder obstructions. If the gallbladder obstruction, there would be the, if the mechanical jaundice will be there, and this jaundice would be the painless condition, or like this cancer would be having the painless condition. Other than the pancreatic cancers, we can have the acute pancreatitis, or other when we can have, that is the chronic pancreatitis. There would be having the chronic pancreatitis, and the chronic pancreatitis, remember, there would be like the pain in the, there would be the pain that will seen in the myorhabson point, the pain in the myorhabson point, and there will be at which place would be there, at pancreatic tail, at pancreatic tail. Then we will be having the Ortner signs. We would be having the Ortner signs, or we could be having, that is the Guber-Grittus symptoms. What are the Guber-Grittus symptoms? There will be the amylase, lipase, or trypsin. All these would be increased. All these would be increased. Okay. So if the amylase would be there, so the patient's amylase or the lipase would be there, the patient will be having land up with the steatorrhea, means fat in the stools, because the lipase would be increased and the patient can have the steatorrhea. And the steatorrhea, what you will see, the stool elastase, the enzyme would be there that we call the stool elastase, and we call this enzyme is the diastase. So this enzyme would also be increased. Okay, so chronic pancreatitis, there is a pain in the myorhabson point at the pancreatic tail. Ortner sign would be there, and along with that Ortner sign are there, and Guber-Grittus symptoms like amylase, lipase, trypsin, and the stool elastase. All these enzymes would be increased in case of the chronic pancreatitis. As in the question they have given the Ortner's and the Guber-Grittus symptoms, they are positive. Urine diastase is increasing. What is the most likely diagnosis? So this is the exacerbation of the chronic pancreatitis. Question number 42. The question number 42, a 64-year-old man complained of the cough with expectoration consists of the blood streaked mucus. Okay, read the question. I am directly coming to the, so we having the two conditions. Finish, okay, finish. I am writing it here, central. Okay, so we having the lung cancer. This is the question number, I think, 42. So if we talk about the lung cancer, remember, in case of the lung cancer, we would be having, this is the central lung cancer, and we would be having the peripheral lung cancer. Central, and we would be having the peripheral lung cancer. So if you talk about the central lung cancer, remember, it is present at the near the entrance of the lungs, means at the roots of the lungs. It is present at the roots of the lungs, and it is common in the smokers. Like if the patients with the smoking and have the history of the smoking, so you can suspect that this patient can having the central lung cancer most commonly. Then this patient is associated with the one carcinoma, that is the squamous cell carcinoma. There with the squamous cell carcinoma, and in this patient there would be the hypercalcemia would be there. Hypercalcemia would be there, means calcium level would be increased. And these are also associated with one other carcinoma, that is the small cell carcinoma. They are associated with the another carcinoma, small cell carcinoma, or another one is what, that is the oat cell carcinoma, that is the oat cell carcinoma. And there would be the Cushing syndrome. There would be the Cushing syndrome. They are associated with the Cushing syndrome, ectopic hormone productions. The main thing in the central lung cancer, you have to remember that they involve the roots of the lungs. They involve the roots of the lungs or the entrance of the lungs, like the hilum part from the where the bronchi, the nerves, or the everything will be entered into the lungs. So that consists of the central lung cancer. In the peripheral lung cancer, remember, they include the bronchi and the air space. They include the bronchi and the air space. This can be seen in both smokers and non-smokers. This can be seen in both smokers and non-smokers. And they are associated with one condition. We call this as the adenocarcinoma. We call this condition as the adenocarcinoma, and they are also associated with the large cell carcinoma. Okay, what is the main thing you have to remember? That it involves the root value and it involves the bronchi and the air space. So what you have seen in this question, that there will be the X-ray shows a homogeneous said lung field on the right with the mediastinal displacement toward the affected site. So what you will see in the X-ray shows a homogeneous, there is a homogeneous shadow of the lungs field on the right with the mediastinal displacement toward the affected site. Now if that is showing that is the mediastinal displacement toward the shadow of the lung field on the right, so shadow of the lungs field toward the mediastinum. So mediastinum, it is the central portion only. So that is what, that is the central lung cancer. If there is an involvement of the mediastinal part or the central part, that means that is telling us about the central lung cancer, and all other findings, they are all the cancer. So that in the question, if they have mentioned about some peripheral things or all those things like the bronchi or the air space are involved, that means they are talking about the periphery. But if they didn't tell us about anything mentioned about the bronchi or the air space, then always go for the central lung cancer. And other findings that is given in the question, they are of cancer. They can be seen in both peripheral lung cancer or also in the central lung cancer. And one thing I have realized that whenever they mention about the central lung cancer, they don't mention about the pulmonary in the options. So this can be the trick. So these tricks you can also follow whenever you're practicing the questions, that because these tricks you can do more than I am doing. Then question number 43, for 5-year, a 35-year-old man has been treated in the resuscitation unit for the acute renal failure caused by the compartment syndrome. The patient is disoriented. ECG shows the high T waves and the high right ventricle. Okay, take a break of 5 minutes, and then we will continue, and we will finish at I think 50th question. बाकी फिर कल देखेंगे. Tomorrow we will do little fast. ठीक है? So we take a 5 minutes break and then we will continue.